We are glad to present our research, Education and Culture Affect Visualization's Effectiveness for Health Communication at the International Conference on Information Visualization 2018. The authors of this paper are Sabrina Bresciani of the University of St. Gallen, Switzerland, Pavitra Arora of the University of Ottawa, Canada, and Sebastian Kernbach of the University of St. Gallen. We already know that knowledge visualization can improve communication and collaboration, but which are the boundaries of this effect? More specifically, which contextual variables moderate the effectiveness of knowledge visualization? The motivation of this study arises from the observation that health communication between doctors and patients is sometimes suboptimal because doctors only speak to their patients, while we assume that utilizing knowledge visualization could increase the effectiveness of their messages. The application context is polycystic ovary syndrome, also called PCOS, which is the most common cause of infertility worldwide. Can knowledge visualization improve the commitment of patients to improve their condition? We set up a field experiment with real patients in India. We found that all subjects are more engaged by the content when read it in a visual format, but that the intention to change behavior is moderated by the educational level. Knowledge visualization in this research is defined as the use of visual and textual items organized spatially in a meaningful way. Which are the advantages of knowledge visualization? Many, really, at cognitive, communicative, and collaborative level, which have already been reviewed in several other articles. In this research, since we focus on health communication, we are interested to study specifically the effect of knowledge visualization on motivation and commitment. According to Pavio dual coding theory, when the same concept is offered in a textual or verbal and in an imagery format, the understanding, recall, and engagement increases. Our previous research in the context of strategic communication found confirmation of this effect. Secondly, the universal meaning of images can help communicating to a multicultural public. We apply these principles to the problem of PCOS. Polycystic ovary syndrome is the most common cause of infertility, affecting 1 out of 15 women all around the world. Women affected by this problem can improve their condition by adopting a healthier lifestyle, losing weight, exercising regularly, eating healthy food, and avoiding stress, and they will be more likely to be able to have children. We specifically focus on India because of the harsh condition women face in India if they are not able to procreate within a few years from being married. Especially in the lower classes, they are often rejected by the husband and avoided by their community. Based on the theory of reasoned actions, we develop a research model in which we hypothesize that the communication format, textual or knowledge visualization format, affects attitude, which in turn affects the intention to implement the content of the communication. We have previously adopted the same research model in a lab experiment on strategic communication, and we found confirmation for Western and for Indian subjects. All the subjects were highly educated managers. In this research, we created 2 experimental conditions of written text and a knowledge visualization with the exact same content. With the support of a local doctor in Hyderabad, India, 100 women affected by PCOS after seeing the doctor received either the textual or the visual version of the information. They were asked to read it and then answer a questionnaire which contained questions on attitude, intention, and control variables such as age, educational level, type of job, familiarity with PCOS, comprehension of written English, preference for the format utilized, and cultural questions such as individualist or collectivist culture with the Singalese scale. For an explorative assessment of the actual behavioral change, 3 weeks after the experiment, a subsample of the patients were contacted via phone interview and asked about which practices they were actually implementing. In the two conditions, the content is equal. In the knowledge visualization condition, the text is organized spatially and accompanied by icons, according to the principles of dual coding theory and multimodal communication. Icons were adapted to the local Indian context. Results. We used validated scales for attitude and intention, and we found that the items loaded well on the expected factors, so we proceeded with the analysis. We compared the attitude and intention for women who were exposed to the two conditions. Indian women affected by PCOS who were exposed to the knowledge visualization format had a significantly more positive attitude toward the content compared to those who were exposed to the textual version. The intention to implement the health suggestions provided was, however, not significantly better. Yet, we found, as predicted by the theory of reasoned action, a significant regression of attitude on intention. Since the results did not fully confirm our theoretical model, we further investigated the data to understand if any of the control variables acted as a moderator. We found a significant moderation of educational level on the intention to implement the health practices described in the information. The lower the educational level, the more the visual format is effective, as can be seen from the fan-shaped pattern in the figure. For women with only mandatory education, such as 10th class or below, the knowledge visualization version led to a higher intention to change their behavior compared to the textual version, but still lower or equal compared to women with a college degree. We additionally conducted a preliminary and exploratory investigation of the actual implementation health practices 3 weeks after the women had been exposed to the information, with a subset of the sample with 30 women per experimental treatment. The results did not indicate any significant effect of visualization, but revealed that the type of job, or actually the lack of job, significantly influenced their behavior. Regardless of their educational level, of age, and any other factor, women with highly qualified jobs were implementing a significantly higher number of health suggestions provided. Women who were unemployed or had very simple jobs, even if highly educated, implemented more health practices when exposed to a multimodal format compared to a textual format, but in both cases lower than women with highly qualified jobs. So what do we learn from this study? Visuals are more effective than text to increase attitude and intention, but not for behavioral change. Secondly, behavioral change seems to be higher for women with highly qualified jobs in India, while unemployed women, even if highly educated, and women with low qualified jobs had significantly more intention to implement what they learn when exposed to a visual format compared to a textual format. From a practical perspective, our results indicate that health professionals should utilize the multimodal format when communicating with patients, especially those with basic educational level. Yet, we see a need of studying culture and subjects variables to test the boundaries of knowledge communication effectiveness and multimodal communication theories. We also need to separate the concept of health literacy and empowerment, also for the Indian population, as already suggested in the literature. Finally, we need to tailor visual health communication to specific cultural groups. The results partially support the theoretical model and offer new insights into the contextual variables which can moderate the effectiveness of knowledge visualization. The interrelation of culture and subject variables need to be further analyzed in order to test the boundaries of existing Western theories and to tailor visual communication to specific subjects and cultural groups. Therefore, we propose an extended model of the moderators affecting knowledge communication to be tested for future research. We'll be happy to receive your feedback and keep in contact. Thank you for your attention.